I'm honestly sick of all of the BS surrounding health and pain and movement. We've seen so many people in pain who've been told to stop running, stop lifting, and stop moving. They've been taught to fear their bodies and fear movement when movement is the one thing they actually need more of. We've spent years teaching people how to get out of pain and get back to doing the things they love. And what we've learned is most people don't need fixing. They need clarity. They need to be taught what their diagnosis actually means, and they need a personalized plan to help them meet their goals. There's so much noise out there about health. I decided to stop getting angry about it and start putting the right noise into the world. And that's what the Made to Move podcast is. Some episodes are about pain and injuries. Some are about how to improve your health. Some are about what it actually looks like behind the scenes to build a different kind of healthcare. So if you want to understand your body, get out of pain, and take ownership of your health, and see what it looks like when a bunch of physical therapists try to change healthcare, this podcast is for you. Because we were all made to move. So in my almost 6 years as a physical therapist at Made to Move, I really learned the hard way that there's one thing that matters the most when it comes to truly solving your pain and achieving movement freedom. And it's not your diagnosis. It's not a certain exercise or stretch or manual therapy technique. It's really what you believe about your body and pain and exercise. And I know you're probably wondering what the heck your mindset has to do with your pain, but I'm here to tell you it actually has everything to do with it. And in my opinion, I really don't think that you can fully solve your pain and live a life of movement freedom if you never address the beliefs you have about your body, because our beliefs can limit our progress. And dare I say, they can actually hurt us because our beliefs affect what we do. They change the way we move, they change the way that we act, and they change the way that we treat our bodies. And these beliefs usually prevent us from doing the things we actually need to do to thrive. But there's a lot of conflicting advice out there, and a lot of these beliefs have been ingrained in our society. There might even be things that you don't even know that you believe or why you believe them. So if you've heard these things and you don't have a great understanding about where these beliefs came from, they might not even be your beliefs to begin with, but we often don't realize that until someone calls them out. So these are the 7 most common beliefs and myths I've seen in patients that have held them back from making progress. So if you're struggling with pain or injuries, some of these limiting beliefs might be to blame, and a lot of these things I also had to unlearn too. Number 1, pain means damage. So pain is a signal that you might need to change something, but it's not a damage report system. It's an alarm system, and pain does not equal damage. Pain is our body's way of getting our attention. It's to alert us like, hey, something might be going on here that we're not super sure about. Can you please go take a look? Pain is super complex and multifactorial, which just means there's not usually one single cause. There might be a lot of contributing factors. And the cool thing about pain is that because so many things can affect it, we have so many ways we can reduce it. So having damage doesn't mean you're going to have pain, and having pain doesn't mean there's damage. And finding something abnormal on imaging doesn't mean you need to be fixed or that you'll be in pain forever. So next time you feel pain, don't assume that something is terribly or permanently wrong. Instead, I want you to think, this is a sign that something might need to change. Belief number 2, impact is bad for your joints. This one is super ironic because really the only thing that makes our joints healthier, stronger, and more resilient is impact. Impact and stress are the things that we need to stimulate a change or an adaptation. You're not going to get better at running by avoiding running. Your knees aren't going to get healthier by never stressing them. But this view about impact comes from the belief that our bodies are like cars and car parts, and that they have a limited amount of usage before they break down and need replacement, or that by doing impact or stressful things, we're going to pay for it later, which is like one of the cringiest statements I hear all the time. But our bodies and joints and tissues are adaptable and capable of healing. Tissues get thicker, muscles get stronger, bones get denser, and that's because we are humans and not cars. There's nothing inherently wrong about impact. It's not like we have a lifetime cap on the amount of impact and stress we can experience. What matters is that stress is applied in a way that allows our body to recover from it and adapt to it to be more prepared for it next time. Stress plus recovery equals adaptation. And if we don't have any stress, there's nothing to adapt to. And without recovery, we also can't adapt. But the mistake I often see people make is that they avoid all impact and stress because they've been told it's bad for them and they don't want to cause wear and tear, which again is really ironic because it's actually the stress and the impact that signals our body to get stronger and more resilient. And without stress, our body has nothing to adapt to. There's no reason for our body to make denser bone or thicker tissue or stronger tissue, so we get weaker and less prepared, which is the opposite of what we want, especially as we age. And this is what happens especially with osteoporosis, sarcopenia. If you don't give your body a reason to build and maintain bone and muscle, you will lose it at an even faster rate than typical aging. And then when you're 60, you're frail, you need help walking, you're at a fall risk, you struggle to go up and down the stairs, life is really hard, and that sucks. So the right amount of stress and impact is different for everyone. I'm not saying that you need to go do 50 box jumps right now if you never do any sort of jumping. But what I am saying is placing stress on our bodies is essential to build stronger and more resilient bodies. And the people who avoid movement and avoid impact are actually the ones who will pay for it later. So belief number 3. If you have pain, you need an MRI. You need to see what's really going on underneath. I understand why this makes sense. Imaging is a super helpful tool that we have in some cases, but imaging doesn't tell the full story. And it's actually advised against for most low back pain, which is one of the common reasons that people are told to get imaging. But most cases of low back pain are muscle strains that can heal and get better with conservative treatment. But using routine imaging reveals these harmless age-related changes, also known as incidental findings. These findings don't explain pain, but they do cause anxiety and stress, and they can lead to overdiagnosis, increased costs, and usually unnecessary and risky treatments. You can have exactly the same imaging as someone else with completely different symptoms. And most pain-free people have some finding on imaging. So imagine getting imaging and being told that your pain is coming from this specific finding. Maybe it's degenerative disc disease, but no one tells you that you can have that specific finding without having pain. But now, instead of seeking treatment that actually might be helpful, you're like, well, I just kind of have this thing. I guess I'm going to have pain. And you're worried about this thing in your back, and then you never make any progress, or you get unnecessary procedures. Your symptoms, function, and history matter way more than a snapshot. Imaging should not dictate your entire treatment. And as PTs, we are trained to know when someone needs imaging. If I hear a red flag, or if there's something not adding up, I will tell you to get imaging. But routine x-rays should not be a part of treatment unless we're watching a broken bone or stress fracture heal, or even an MRI. So belief number 4, I should avoid the movements that hurt. It is very normal and human to want to avoid the things that hurt us. And I'm not saying that we need to push through intense pain, but avoidance doesn't protect you. Modifying temporarily can be helpful. Some movements may need to be off limits for now, but what people often do, they find a movement that's painful and they swear it off forever. What they should do instead is find ways to do a similar version of that movement that's not painful and slowly make their way back into the previously painful movement. So modifying is super helpful. Relative rest is helpful. Completely avoiding positions, movements, and exercises forever makes you less prepared for those things and more susceptible to injuries long term. So instead of saying, since that movement hurts, I'm going to stop doing it forever, ask yourself, what can I change about this to make it less painful? Belief number 5, your disc herniation means you'll have back problems forever. This one straight up frustrates me because no one tells you that disc herniations can heal. They aren't wreaking havoc in your back and your spine forever. So I recently did a podcast with a spine specialist a few months ago, Dr. Jim Eubanks. He's amazing. And he talked a lot about this. So if you want more on that, go listen to it. But I got this message yesterday morning from a patient, so I am going to read it to you. I was a client in 2024. I could barely walk due to a back injury. Dr. Elliott helped me. Go Elliott. I took last year off from competing, and now I'm back on my training blocks completely pain-free. So she had a disc herniation. And we've worked with so many people who have had back injuries and disc herniations, and now they're back to lifting and moving without fear. How cool is that? Your body is adaptable and it can heal with the right tools and the right environment and the right mindset. Injuries do not have to determine your whole future, but often we're given this diagnosis and we're not told that it's temporary. And it might be a part of your story for sure, but it doesn't have to become your identity or your future. And the belief that you're going to be limited forever is actually what's holding you back. Belief number 6, bad form causes injuries. Obviously, this one is everywhere. And first of all, I'd like to ask, what is considered bad? So people have been taught that there's one specific way to move or perform an exercise, and if you stray from it, you're going to get hurt. But why would our bodies be able to move so variably if we weren't supposed to? And there's no such thing as a bad movement, just movements your body is either prepared for or unprepared for. That doesn't mean that form doesn't matter. That doesn't mean I'm going to take a 6-year-old who never deadlifts and tell them, yeah, not only let's deadlift, let's round your back with 150 pounds there, Susan. No, because context and preparation matter the most. And you could deadlift with the most perfect form. And if you do something you're not prepared for, or you're overtraining, you could still get injured. Perfect form does not protect you. Just like straying from it doesn't automatically hurt you either. Again, it's the dosage and it's about how we are gradually preparing for it. That's what matters. And lastly, number 7, my personal least favorite, I probably just need to stretch more. Whoever Big Stretching hired for their PR and marketing did an amazing job because for some reason, everyone has been told that stretching solves all their problems. And I think we just like the feeling and sensation we get when we stretch a painful muscle or joint because that strong sensation makes us feel like we're doing something good for us, but it's just often not the thing we need to actually solve this pain. And the reason this frustrates me is because people go to physical therapy, they're given a couple stretches, and when it doesn't work, they think, well, I guess PT didn't work for me. You know, I must be doomed forever. I must need surgery. When in reality, they can get better. They just weren't given a good plan or a plan at all. Stretching can feel good and it can have benefits, but by itself, for most active people, it is not solving the actual problem. It can be part of the solution, but I think it's just over applied as a treatment for pain and injuries. So if you've had pain or an injury and you want to solve it, you need more than just a couple of stretches. So these are the 7 myths I hear and see every day as a physical therapist. And in my experience, the patients who have truly gotten better have had to address and unlearn these things. You won't be able to change your pain until you change your beliefs about pain. So maybe you know someone who has tried so many things to solve their pain and they're just still struggling, or all the treatments they've been told to do aren't working. Please share this with them or anyone you think needs to hear this. And if you want more of this, I send out a weekly email all about pain, health, injuries, and movement. You can join in through the link in the show notes or the caption. And if any of these hit a nerve, there might be a reason why. Let me know. Thanks for listening.